Welcome to British Biomedicine Institute. Today we will explore radiography of the skull and radio diagnosis. A skull X-ray is an imaging test doctors use to examine the bones of the skull, including the facial bones, the nose, and the sinuses. Patient may undergo a skull X-ray of decalcification of the bone, deformities in the skull, fractures of the skull or facial bones, frequent headaches, infection of the bones of the skulls, occupational hearing loss, tumors. The skull, also called the cranium, is the bony structure of the head. Two sets of bones comprise of cranial bones and facial bones. All bones making up the skull are attached to each other by movable joints, except for the jawbone, which is attached by a movable joint. X-rays of the skull may be done to diagnose fractures of the bones of the skull, birth defects, infection, foreign bodies, pituitary tumors, and certain metabolic and endocrine disorders that cause bone defects of the skull. The skeleton of the face has 14 bones, which include those that make up the jaws, cheeks, and nasal area. Skull X-rays may also be used to find tumors, check the nasal sinuses, and detect calcifications within the brain. Due to the complexity of skull anatomy, technologists require an in-depth understanding and attention to detail during radiographic imaging of the face and skull. The town view is an angled anteroposterior radiograph of the skull and visualizes the petrous part of the pyramids, the dorsum celli and the posterior clinoid processes, which are visible in the shadow of the foramen magnum. The skull imaging study has a long list of indications that can practically be classified as trauma, benign or malignant, focal skull lesions, and systemic pathologies affecting the skull. CT scan is the principal modality in imaging of the traumatic skull lesion, since it not only provides perfect visualization of cortical bone, but also offers a very short imaging time, allowing immediate intervention before brain damage or death. CT scan and MRI are complementary modalities for imaging focal skull lesions, and both are performed in most cases, especially in skull-based lesions. Thank you for showing interest in British Biomedicine Institute Skilled Nano-Degree Program. Hope you have gained a lot of clinical information through this presentation. Please share, like, and subscribe British Biomedicine Institute channel. Good luck.